And you are welcome. On Health today, we are joined by Dr. Perfecta Osawaru, aka the Pain Healer. Now, she's an alternative medicine practitioner and also women's health specialist. We're talking what's causing your abdominal pain and when to see a doctor. Perfecta, you are welcome on the show. Thank you very much. Alternative health, what is that exactly? What kind of alternative?
So alternative health has to do with other form of medical practices that is not the orthodox form of medical practices. So we're going to be using holistic healing, holistic therapies to provide solution to people's problems because everyone wants to go natural these days.
Natural. This would include what now? Herbs or what?
Right, herbs, acupuncture, right, cupping therapy, moxibustion. There are many other therapies that are not necessarily so invasive and all of that, but they are natural.
Interesting. Very interesting to hear you talk about it like that. Now let's talk abdominal pain. What are the causes of abdominal pain that people could actually have, and why should it be of great concern?
All right. Okay, so when you start with abdominal pain, I like to state this fact that abdominal pain is not just a bad stomach ache, because oftentimes what people think about when they deal with abdominal pain is, I'm having a bad stomach ache and then that's it, right? Because the abdomen itself is everything in the belly region, from the chest, the ribs, and even the pelvis. So you want to state the fact that a bad stomach ache is not just abdominal pain, because it can be discomfort in any of those regions. There are like a lot of organs there that can be any of the causative reason why a person is dealing with an abdominal pain.
So positioning is obviously a thing.
Yes.
It could be upper, lower, mid, or moving around. Right. When do I know which is actually which ailment? How can I tell the difference?
Okay, so when a person is dealing with abdominal pain, for the practitioner, it will be based on what the person says. So there's really no magic one to say, oh, this is exactly what's wrong with you. Because on the practitioner level, the person can either segment the abdomen rather into 4 parts, or for a more broader view into 9 parts, right? So now, yes, so it's the location is one of the factors. It's not the only one. It's, like I said again, it's to the degree at which the person can explain what's wrong with the person that can help in narrowing it down to say, okay, this is what it is. Now, when it comes to the segmenting, again, a person can complain of severe pains in the upper part here, that's the middle part, the epigastric region, and it can mean a lot of other things, more than just ulcer, right?
Oh.
Yes.
Upper part could be ulcer.
Yes.
What if it's lower and to either side?
No, so now that's it. There's lower left, there's lower right.
Yeah.
Right, so for the lower left, person can be dealing with bloating issues, can be dealing with diverticulitis, and all of that other stuff. For the right part, it could be appendicitis, it could even be ovarian cyst. Now, again, like I said, the reason why many people just classify their abdominal pain as a bad stomach ache is because they're using someone else as the standard for their pain.
Oh, okay.
So you hear people say stuff like, my auntie or my friend described that she has the exact pain. And now because she or he is dealing with that exact pain and it's in the exact region, doesn't mean that that's exactly what you're dealing with.
So how can you narrow it down for the person for the sufferer? How can you narrow it down to tell exactly what might be going on with them? Right,
now I'm going to start with the same epigastric region that I said about. Now, when it comes to like ulcer or GERD, which is gastroesophageal reflux, and some people complain of acid reflux and all of that, and it still comes from the same region, the epigastric region.
Yeah.
So when person is dealing with ulcer and person is dealing with GERD, person can have similar symptoms, heartburn, pain in that region.
Yeah.
But then one of the differentiating factors will be if the person is dealing with a pain there, from this upper part, and it's from the upper part of the stomach to the chest, and then it keeps, going upwards. Reflux. It could be like a reflux. That's a GERD thing. When the pain is localized in that particular region, it could be an ulcer thing going on. Because then again, people can have GERD and not have ulcer. But so most people that have ulcer also deal with GERD. So again, it's not just about the locality, like, oh, this is where the pain is localized in. It's also more of the symptoms that the person can express with medical, laboratory testing to ascertain.
I'll give you one very typical example. One example that I experienced. Now, it was a pain that actually moved all the way from the upper region all the way to the bottom part. It moved down, and it took a couple of days. And it was all over the place. It would be local for a couple of days, and then it moves all the way down. What could that have been?
Okay, then again, it could be local, and then it could move around.
Yeah.
There's another thing that we could talk about, which is referred pain. Sometimes, most of the pain that people deal with is not even coming from any of the organs there. Sometimes. it's a referred pain. It could be from somewhere else, and then you're feeling it there. That's why you cannot just ascertain and say, oh, because my pain started from here, and then it moved down to here, then this is exactly what's wrong with me. Again, the organs there might be a pointer. Like you said, if it's probably like in the middle part, you could have been dealing with maybe gastroenteritis, an infection or something. If it was lower belly, it could be an infection, like anything that you're male, you're not a female. So I would have said,
yeah, I was also going to say that your gender, your sex also matters as well.
Yes, your sex also matters. Like, okay, this is what's wrong with you, and what time, again, that you're dealing with. Exactly. Because most ladies can also complain of that kind of lower abdominal pain when it's time of
that special time of the month. Okay, so when do I see a doctor? When is it necessary that I see a doctor then?
When it has exceeded maybe a day, or if the pain is more severe, you can't bear it. Now, again, when I say that, pain threshold differs for people. Some people have now, taken up pain like in such a way that they can bear it for 5 days, 7 days.
Yeah, we're Nigerians. We can't bear pain for 10 days. I've been bearing this one for 14 days. Oh, sorry, that feels casty. But yeah,
so pain threshold, again, that's one of the reasons why people don't even seek out for solutions to whatever is wrong with them. So I'd say that when you see that it's not your normal, when it has exceeded what normalcy looks like to you. Normalcy, I mean normal, the standard normal, not what you feel like is normal. So if you start feeling extreme pain and it's causing you discomfort, you can't eat, you can't have like frequent bowel movements and all of that. Especially when it's sharp, throbbing and all of that, you need to speak to someone about it.
So
generally,
in between that time when I feel that pain and when I get to the hospital, how can I take care of that hurt?
Okay, how can you take care of that? It depends on what's really wrong with the person. But for starters, I'd say take a walk. I'd say
Take a walk?
Yes.
As simple as that?
Yeah, I'd say get more, many people experience those things due to dehydration. So I'd say get more hydrated like that so that you can, maybe pass out stools and then, ease up all of that. Another thing would be to increase your fiber intake. Eat food slowly.
Eat slowly.
Yes.
Eat plenty of fiber.
Yes.
Fiber would mean what kinds of food? Fruit?
Oh, foods that are rich in fiber, vegetables,
Vegetables,
fruits, and all of that. So try to incorporate it into your diet, because many people just keep going fried foods, fast food.
Would oat help? Plenty of oats.
Yes,
that would help. That's plenty of fiber, isn't it?
Right.
Yeah, I'm an oat warrior. I like oats. Okay, well that's very interesting. What about placing warm? What do you call them now? The bottles.
Bottles.
Yeah.
That would really be dependent on what's wrong with you again.
Oh, okay.
Right? Because then again, you're doing that because it's somehow like a standard for everyone to do. Oh, you're feeling this, place a hot water bottle on that. But again, you want to know, with the help of a practitioner, to help you narrow it down with your history and exactly your lifestyle, your diet, what you eat, how long that pain has been. All of that is going to, be a reason to help.
Perfecta, all through this conversation, we've had your social media handle on the screen. So I'm sure that there's going to be plenty of questions because we can't totally exhaust all here on the show. So do expect some questions on your handle. And if you want to send it in as well to us, use the hashtag WakeUpNigeria_TVC. You can refer to this segment here or maybe even on our social media post for this segment. You can ask the questions there. And I'm sure Perfecta is going to oblige you with the answers. Thank you very much, Perfecta. I hope we see you again next time. Please do come. Let's talk more health.
Right.
Thank you.